I'm in the School of Kinesiology within the athletic training faculty. My primary area of research is sport concussion. I got into concussion research as an undergraduate student. My advisor at the time was in the field, and I just started hanging out in his lab, doing work more from a clinical perspective, so doing preseason testing to help out for clinical reasons. But that morphed into doing it for research. When I started in the field, the research that was being done was very rudimentary. We had just a very weak understanding of kind of what even the injury was, how to evaluate it. There was a lot of questions that needed to be answered, and so it's really been a good field to explore. The primary area that I focus on is high school athletes, which represents the largest single group of individuals that are participating in athletics. So if you think of a typical college setting or professional setting, there's numerous medical professionals that are on the sidelines and the athletes can easily have access to. At the high school setting, there's only about 50% of the high schools have access to an athletic trainer or another medical professional, and that's on a part-time basis. So really, it's a huge population that's highly underserved by the medical community, and I think it warrants a lot of attention from the research. There's been significant attention around concussion, policies surrounding concussion. The NFL has been reasonably aggressive in trying to change their policies. I think probably what's been more phenomenal, though, is that we now have legislation in every state in the country that addresses concussion, removing athletes from play, mandating some sort of medical clearance before they go back into play, and education of athletes. And it's really the only injury that I'm aware of that has legislation surrounding it. And it passed through all 50 states within a matter of a couple of years, which is truly outstanding. And it's a good thing that it's out there. Probably one of the biggest challenges that healthcare is facing right now is the cost and the accessibility. And I think those things go hand in hand. A lot has been done to try to bring the cost down or rein the costs in, but really people are still lacking access to medical care. Rural communities, they don't have the resources that larger cities or even suburban populations have. But I think if we can improve that, then I think we're going to help the lives of a lot of people. The IHPI at the University of Michigan is there to increase awareness and access to healthcare for people that are in need of it. We know that healthcare access is a major issue facing our society, and they're there to try to change policy and affect policy in a way that's positive for everybody. The University of Michigan, I think the different schools and the different colleges on campus can contribute to the IHPI, but the strength of those schools and those colleges. We have world-class medicine here. We have world-class kinesiology and engineering. The IHPI has the resources where all those groups could come together to collaborate under one roof. And certainly being close to each other physically, intellectually has a lot of benefit into getting work done. I think in the future, healthcare, particularly when we talk about concussion, I can see a lot more telemedicine being involved. So diagnosis being done on the sideline within a matter of minutes, if not seconds, and then that information being relayed to a physician or another healthcare practitioner. And I think that's a very effective model where multiple patients can be seen without the physician ever having to leave the office. I think the IHPI could make something like that happen in a variety of different ways. I think bringing researchers together to develop the actual test that would be used, bringing researchers together that would make the telemedicine portion of it work, as well as bringing policymakers together. All those things can be facilitated by a group like the IHPI and bringing strong researchers together to work those problems out.